Dan here at the CQU Student Chiro Clinic, and I'm here to show you a therapeutic ultrasound machine. So therapeutic ultrasound is a little bit different than diagnostic ultrasound, which makes a picture to look inside the body. We can also use sound therapeutically to help tissues heal faster, and that's what this machine here does. So it doesn't make any pictures, it's just for treating patients. This machine has two separate transducers, and this is a transducer. This is where the sound would emanate from. One is a little bit smaller than the other. For today, we're just going to use the larger ultrasound head, which is the one that's most commonly used. So, ultrasound is just high frequency sound. So this is effectively kind of like a very small loudspeaker that sends out sound waves that are very, very high frequency beyond what we can hear. So it's designed to send out sound waves at 1 megahertz and 3 megahertz, right? Which is way, way beyond the 20 kilohertz that we can hear as humans, right? So now what does ultrasound do? Ultrasound is basically a way of vibrating tissues. So we can beam that sound through the skin, and it causes vibration of the tissues underneath. We can use that for two different purposes. One is to provide some heating, and the other is to provide sort of like a micro massage, where we're going to jiggle those tissues around really, really fast. The application for those two things are slightly different, right? So if we use the ultrasound machine to make heat, that's going to increase circulation, it's going to increase cellular metabolism, and also increase the level of cellular function, right? So for mechanical transduction or micro massage, what we're trying to do is to break up adhesions and cause changes in cellular permeability and membrane permeability, which also helps the cells to heal faster. So just to note, there is some overlap between the two. In terms of mechanical transduction and heating do both happen, but we can bias towards one or the other depending on how we set up the machine, right? So generally, if we're looking at very chronic conditions, we want a little bit of both. We want to improve metabolism. We also want to break up any adhesions in the tissues, improve the health of the tissues and the circulation through the tissues. So in general, we use this on soft tissue. It's not meant to be a bony osseous treatment. In fact, we try and avoid bones wherever possible. It works best on soft tissues, meaning connective tissue, tendons, muscle tissue. All right, so that being said, we can bias the machine to target any of those tissues. So with sound, sound travels through different densities of tissues at different speeds, and it also reflects and refracts very much like light does, so from a physics standpoint. So we want to be able to, number one, minimize the reflection off the skin. So from outside the skin to inside the skin, we want to minimize the reflection. One of the ways we do that is we apply a little bit of aqueous gel. So we'll put some gel on, and that acts as what we call a coupling medium. So it helps to minimize the reflection and get as much of the energy that's coming out of the transducer to go into the target tissues as possible. So as a rule, the deeper the tissue, the less energy is going to get there. So in muscle tissue, we can penetrate on average to about therapeutic levels to approximately 2 centimeters. But generally, like every little bit of distance, the amount of energy that we're delivering is going to halve, right? So, and in a tendon, we may only penetrate a few millimeters. So they sometimes require like a slightly different settings on the machine. So in terms of setting up the machine, for deep tissues, for example, a muscle that has more thickness to it, we're going to use a lower frequency, meaning 1 megahertz, and we're probably going to need more power, more energy to deliver a therapeutic dose to those tissues. Whereas if we have something superficial, like some of the tendons that go to your wrist or to your hand, they're right near the surface. They're also small structures, so we don't need as much energy. And we can use, number one, a higher frequency and less energy. And when we talk about energy in ultrasound, we measure it in watts per centimeter squared, so energy per unit area, right? And that's sort of the standard that we work on. So for small structures, we usually stay between 0.5 watts per centimeter squared and 1 watt per centimeter squared. And for larger structures, we may go a little bit higher in terms of the power, somewhere between 1 and 1.5 watts per centimeter squared. Now, the higher that we set the watts per centimeter squared means the more heat we're going to generate. Heat can be therapeutic, but this machine can very quickly get hot enough to cause burns. So you have to be mindful of that. So in terms of power setting, we're always quite conservative. We never go beyond that 1.5 watts per centimeter squared. We can control the amount of heat in a few different ways. One is by controlling the intensity of the sound that's coming out in watts per centimeter squared. We can also adjust the machine to deliver pulsed ultrasound, right? So we can change what's called the duty cycle. So we can use 100% duty cycle where that transducer is making sound the entire time, delivering energy the entire time, and that's going to create the most heat. Or we can use a pulse setting where we can have the machine on 50% of the time and off 50% of the time, which allows the tissues to dissipate some of the heat, so the circulatory system to dissipate some of the heat and control temperature that way. And we can go as low as 20% duty cycle, which is more for, like we said earlier, like a micro massage to get those tissues vibrating, break up adhesions, stimulate some permeability of the membranes, cell membranes, and help tissues to heal faster. So you do have a little bit of flexibility with the machine. Let's show you how to use it. So let's get started. Now, lateral epicondylitis is the type of condition that we typically use ultrasound for because it is primarily a soft tissue condition, right? So to set things up, the elbow, everything is quite superficial, so we don't need to penetrate very deeply. In fact, if we penetrate too deeply, we're going to heat up the bone, and that can be very uncomfortable and cause some burns to the periosteum. So we're going to set up the machine in terms of the frequency, the duty cycle, which we talked about earlier to manage heat, and also the power level. All right. So in this machine, once you've plugged it into the wall, it automatically turns on. And then there's just a couple buttons here to help us to change the frequency and the duty cycle. So it's quite straightforward and easy to use. So to set the frequency, we're on 1 megahertz. We don't want that today. We're going to set it up for 3. I'm also going to set for now, I'm going to set the duty cycle to 50%, so the machine's going to be on half the time and off half the time. We're going to use some coupling medium, which is our aqueous gel. It's generally non-allergenic. It's probably a good idea to ask your patients whether they do have any allergies, and it will not stain clothing. It's all water-based. So you can reassure your patients that they'll be all right. So we're going to take that and smear this around over the region that we're going to treat. And before I start the machine, I'm just going to tell you a little bit about the importance of keeping the head moving, particularly when you're at full duty cycle or higher power levels. You can generate heat very, very quickly. So you want to make sure that you're moving this head at all times. It never stops moving, and you're not just moving in small circles, because effectively here you're just transmitting the area to a slightly larger area than the head. We want to spread that energy out a little bit. Okay, so to get the machine going, very straightforward. We're just going to turn up this dial, and that's 0.5 watts per centimeter squared, and that's on the reasonable starting point. In this case, in a young, healthy female, we can probably use a little bit more power with a healthy circulatory system. One of the things that you need to be concerned about with people that have compromised circulation is they can't get rid of the heat as easily. So you have to consider that when you're setting up the machine. So for example, a diabetic, anyone with any peripheral vascular disease, you have to be a little bit conservative with your settings.